Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, we'll be talking to Dr. Arun Garg, who generally co-hosts this program with me because we have a collaboration with Canada India Network Society, and we try to bring to you those experts who are experts in their own fields, and their focus is to tell us as to how we can think about integrative thinking, and also from all over the world, and especially India and Canada, because both the countries have something great in them. But how to collaborate, that's the focus. So today we are very proud to have Dr. Arun Garg as a guest, because today he's going to tell me something very important, because in June we are having the annual conference of CINI, and this year special focus will be on women's health and integrative thinking. So let's get over to Dr. Arun Garg and learn from him as to what all we can expect in the month of June from Canada Indian Network Society. Dr. Garg, good evening. How are you, sir?
Good evening. Very nice. Thank you. Very nice to be guest in this capacity.
Absolutely.
It's always a pleasure to be sharing with our viewers what we are doing and how we are building towards healthy civil society. So thank you for
Absolutely.
having us.
Thank you, sir. And before I move forward to CINI 2022, I would like to start from CINI 2021, because that was a time during the height of COVID crisis, you continued having your conference virtually, and the kind of panelists you had, and we brought them over, and people learned a lot from their knowledge and wisdom. So that conference was held, and after that, some recommendations were made. So let's start from 2021 as to what has been the feedback. What about the recommendations which were given? Where do we stand as far after 1 year? What all has been done?
Thank you. Then thank you for providing us the opportunity to share with viewers what we achieved. As you know, right from day one when we started, we said that our conferences are different. These are not just meetings where people come and present their ideas and then they go home. We design agenda with specific recommendations, and then we work very hard between conferences to facilitate them and make them happen. So the theme of 2021 was lowering the burden of chronic diseases like diabetes and the voices from the trenches. But our journey goes back to 2010 when we made a major recommendation that Fraser Health, because it has such a large South Asian population, should develop capacity within its programs which are culturally sensitive, culturally effective, culturally efficient, and have some capacity and knowledge base on South Asian population. And that was a really turning the whole thing that's never been done before, and to best of my knowledge, it doesn't exist in Canada in any other institute where you have a focus on a population base in a very broad basis. So we were very proud of it,
Mhm.
and the reason I'm raising that is that concept took long time. All these things take long time. That one I think I must share with you. It's easy to make a recommendation, but to turn that into a project and turn into a reality takes a lot of work. And I'm very proud that CINS stays with it, persevere it, and then have a lot of patience, but never give up. So
Mhm.
that recommendation of South Asian Health Institute came alive during COVID, because we had said that it'll be capacity within Fraser Health, and though CINS is not direct part of the operation of the South Asian Health Institute, but the idea germinated through our conference, and we continue to support and work in collaboration. And when it time came for vaccination and the vaccination reluctance and vaccination availability, the having that capacity and having dedicated people, having coordinators, having volunteers was very helpful. And there was a front page story in Vancouver Sun confirming that. So my hat off to Fraser Health, and my hat off to our own idea that we suggested it, and South Asian Health Institute is alive and contributed significantly in
Mhm.
vaccination program. There was a presentation in 21,
Mhm.
and major thing at that time was their contribution in diabetes field, and diabetes was the main theme. So we'll continue with that. But the major recommendation of 2021 was that there should be a broader diabetes network affiliated with major mainstream, and there is a BC diabetes network coordinated by Institute of Health System Transformation and Sustainability and the BC Quality Council. And CINS had asked for that we be member of that and participate on the South Asian file with them. And I'm very happy to share with you that that has come alive. We have a network through them. They have a focus on South Asian health, and we are starting to support them with some roundtables to go deeper into why there is this high diabetes and what individuals are thinking. We had a roundtable on youth as part of that recommendation, and that was so revealing how to engage youth in this diabetes journey or better health. So I'm very happy to share with our listeners and viewers that we had an idea, we made some recommendation, and we delivered on it. So I think that's very good. So that was one recommendation. The other recommendation was to support some research and some evidence in lifestyle intervention. So if you as we have always said, integrative thinking is a big part of this intervention. But if you're going to do a project, you have to have evidence it's working. So we have made some applications based on those recommendations, and we are waiting for the outcome of those research grants. And if that happens, then we will be undertaking a major collaboration with our own Kwantlen Polytechnic University and City of Surrey, and that will be a major fulfillment of those recommendations. But the recommendation was that CINS will make effort to make this application, and we have done that. So that's really very positive, and again shows that how we operate. So those were the two major ones. We had in India the continuation of leadership, and we had LEADS program to take the program to India. That has been achieved, but that was already in the works before our conference started. But we said we will facilitate. So at least 20 people have taken that course. It's an online course available, and these are Canadian professionalism, ethics, business, leadership training, all those things which are very important in being successful as a health practitioner. And we have played a major role in developing that, and we continue to work with our partner LEADS Global and CAHO, a consortium of accredited health organizations in India, to develop it. And we are hoping that this conference will add some more value to it. So in some, I'm very pleased with the outcomes. As you know, we are a small organization with big heart, big ideas. And the key thing which I want to share with our listeners is, and which is distinguishes our work, is that we are very focused in our activity, and we are very focused in outcomes. And we say, got an idea, let's do it. And I'm hoping that we will bring the same energy in taking and moving the agenda of integrative thinking to integrative health. And we'll talk more about it later.
Absolutely. There's no doubt CINI has come a long way from its inception. Your dexterity, your perseverance, and your passion for this is evident that every year you are bringing something different for the benefit of the common people, and that's really commendable. Dr. Garg, we'll go for a break, and once we are back after that, we will start off with CINI 2022, because this year your focus is on women's health. So what all is happening in the conference, when is it starting, and what all people can expect from it, we'll talk in details after this short break.
हर रंग है साडे को, हर मॉडल, हर एक दी अपनी वक्री पहचान। असीं एक परिवार आ, साडा कर्म है अगे वधाउणा, सफर नूं सौखा बनाउणा। बसंत मोटर्स, तुहाडे नाल, तुहाडे करके।
है जुल्म ढाने का अंदाज भी कितना हंसी, हमारी जान पर बनाई है जब जब उसने अंगड़ाई ली। कभी खामोश रहते हैं, कभी शोर होता है। मोहब्बत में शरारत का मजा कुछ और होता है। दिल को जज्बात का तोहफा, खामोशियों को बात का तोहफा, खूबसूरती में जड़ी नजाकत अदाओं की चांद से मुखड़े को चांद सा तोहफा।
भारत ज्वेलर्स, सच्चे प्यार की चमक जैसा। फाइल बिजनेस सेंटर सरी।
ਕੁਦਰਤ ਦੇ ਸੌਮਿਆਂ ਦੀ ਵਰਤੋਂ ਆਯੁਰਵੇਦਾ ਰਾਹੀਂ 5000 ਸਾਲਾਂ ਤੋਂ ਚੱਲਦੀ ਆ ਰਹੀ ਹੈ ਤੇ ਹੁਣ ਕੈਨੇਡਾ ਵਿੱਚ ਹੀ ਬਣਾਏ ਗਏ ਹੈਲਥ ਕੈਨੇਡਾ ਵੱਲੋਂ ਅਪਰੂਵਡ 100% ਸ਼ੁੱਧ ਆਯੁਰਵੈਦਿਕ ਡਾਇਟਰੀ ਸਪਲੀਮੈਂਟਸ ਦਾ ਲਾਭ ਲੈ ਸਕਦੇ ਹੋ। ਸਟ੍ਰੈਸ, ਐਂਗਜ਼ਾਇਟੀ, ਇਨਸੋਮਨੀਆ, ਬਲੱਡ ਸ਼ੂਗਰ, ਕਿਡਨੀ, ਬਲੈਡਰ, ਹਾਜ਼ਮਾ, ਆਈਸਾਈਟ ਜਾਂ ਕਿਸੇ ਵੀ ਕਿਸਮ ਦੀ ਬਿਮਾਰੀ ਦਾ ਆਰਗੈਨਿਕ ਇਲਾਜ, ਜੋੜਾਂ ਦੀਆਂ ਦਰਦਾਂ ਤੇ ਸਰੀਰਕ ਮਸਾਜ ਲਈ ਕਈ ਕਿਸਮ ਦੇ ਆਯੁਰਵੈਦਿਕ ਤੇਲ ਵੀ ਉਪਲਬਧ ਹਨ। ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਲਈ ਕਾਲ 604 628 2003।
Once again, welcome back to the program. This program is being brought to you with the support of Best Home Kitchen Cabinets. If you want to install cabinets in your home, then you can contact Best Home Kitchen Cabinets. They are well known in the market for small and big projects. For more information, call 604-591-8171. Our next sponsor is Agnihotri Immigration Consulting. If you're wanting to know about your temporary status, you are a PR, you want to come to Canada, or you are new to Canada or an international student, Neera Agnihotri, who has been working as a certified immigration consultant since 2006, can help you. Call her at 604-597-2284. Our guest today is Dr. Arun Garg, and we are talking about CINI 2022. Before the break, he talked about the success of CINI 2021 and what was achieved, and the recommendations that were put forward are achieving results. So what is going to happen in the month of June? When is this conference is being held? What all we can expect? Let's learn from Dr. Arun Garg. Yes, Dr. Garg. So what's happening in the month of June? Everybody is very excited about it.
Yeah, so we chose the month of June because it has special significance from our original work. As you know, June is also International Month of Yoga, and 21st of June is International Day of Yoga. And as it happens to be, our conference is on that weekend, third weekend in June. So the dates are this year, June 17th to 19th. We start with Friday with a bit of a opening ceremonies and welcoming and supporting and highlighting our sponsors and supporters, which are so important for any success. But the main program is on Saturday and Sunday. And since last year, we have made so our programs are open to public. So they will be open to public. It looks like, given the Omicron and given all the viruses, that it will still be a virtual meeting. And the theme is women's health. So the main program which will be of interest to your listeners and viewers will be on Saturday, June 18th from 8 o'clock to 12 o'clock. And we will have 10 or 12 speakers there locally, and we call it Voices from the Trenches. And they will be sharing their experience and making recommendations going forward for women's health. So we have chosen purposely this very practical and very topical issue of women's health, and with the lens of South Asian women and South Asian health. And it doesn't matter where you turn, there is a difference for gender. And I think this one of the biggest gap which exists in modern medicine is that modern medicine mostly is based on studies which are in non-visible minorities, and it showed up in COVID. So emphasizing individualization, personalization, and cultural sensitivity is important. And women's health of South Asian background is no different. So one area will be, and we are collaborating with major researchers from University of British Columbia and Cancer Agency on cancer. So lowering the burden of cancer in their main thing is lowering in everyone, the general public, but they have identified us as a partner, and we are partnering with them already on South Asian women. So there will be presentation by that group on women's health related to cancer and what makes South Asian women unique. There are evidence that there is increased preponderance of cancer in some types and uptake. So there will be a very important piece of presentation and then hopefully recommendation to go further. Similarly, there is women's sexual health. Again, there is ever increasing concern that women from South Asia are not getting the exposure or the access to some of the screening tests, preventions, and health promotion. So there will be a topic related to that. South Asian women and the lens on diabetes, and especially in pregnancy. So we will have some practical areas to explore why, if there are hindrance and reluctance to get screened during pregnancy, and we explore those. And nice thing is that these are all very practical examples where then we could make recommendation to improve right in our backyard. Then we have collaboration with, or we're bringing one of our own local who are doing some work in India with maternal health. So they will be sharing what that looks like, what they're doing. Then KPU team is very interested in doing studies on intervention. And so they will be sharing the intervention, lifestyle intervention, and special requirements for women in that setting. Um, Other area which is of very importance is mental health, mental wellness, anxiety, depression, uh, uh, all those things. So lens of uh, a woman's perspective. And again, locally, there is a lot of interest, so we'll be sharing and bringing some speakers. So all in all, it will be a very practical session, and our speakers will be mostly local who are actively involved in these projects, and they will be sharing in 7 minutes to 10 minutes with general public. So it will be at a level that people can understand. It will
Right.
be for general public, and uh, about 3 hours of these kind of topics.
And Dr. Garg, as the focus is on integrative thinking and integrative health, so when it comes to women's health, will that focus also be brought forward in this?
Yeah, so integrative thinking, as you know, as we explore it, it's a way how you think about problem. It's not like a problem itself, but how you think about a problem. So in terms of health, what we're talking about is you have to look at the system as a whole. Our system has become very fragmented, and everybody just thinks in silos what they are doing.
Right.
So our thing is, how do we bring that thinking so that it becomes part of curriculum, it becomes part of training, and when people are faced with this, they think of this, and there is capacity. So you provide total uh, uh,
Solutions.
support to the person, and you think of the person as a whole. So that's what
Right.
integrative thinking is, and integrative thinking then leads to better health. So
Absolutely.
each one of the speakers will have that as one of the theme, like they'll be describing total system. But on Sunday, we are dedicating whole day to build capacity in integrative thinking. And integrative thinking, in our context, takes tremendous energy from our ancient wisdom of yoga philosophy. And yoga, the word yoga itself means fusion, and fusion means um, bringing things together, and people use it in different ways. And the role of body, or the physical body, is well understood, and most of the uh, industrial post-industrial reductive medicine, allopathy, is very advanced on what we call physical medicine,
Right.
how the body works, and deeper. But when it comes to how body relates to mind or intellect, or other way around, how intellect and mind influences health, we are we have quite a gap.
Right.
So I think that's what our wish is, or this is what our ambition is, that we could fuse the best of that thinking of integrative thinking with
Right.
physical thinking and produce a product which produces better results. And that will be on Sunday. And we will have Dr. Nagendra. Again, because of COVID, there is a bit of reluctance, but we will have otherwise on a virtual meeting. And then Dr. Jivasu, who is running a very practical somatofillness, he'll be share his ideas. And then we are hoping that our local training centers will participate in it. And on the side issue, we are having a presentation by Dr. Dinesh Mehta, who is the director of Integrative Thinking, Henry Benson Institute of Mind, Body, and Medicine at Harvard. He will be sharing in March at our work with RCH Foundation, but we are hoping that he'll be available to lead a panel discussion, and then hopefully we could link that to our local training centers to see how we move the needle. So
Okay.
all in all, the idea is not we just talk about it, and because already medical practitioners are adopting it, and as you know, we're going to have in our regular show with you one of the
Right.
doctor who is practicing integrative health, and we want to share with our viewers how that has affected, how that making better health. But we really want to go even deeper, Harpiji. We want to see if there is room and interest and commitment to bring this in training program, so people are exposed to these ideas early, and so when they practice, they can use it. And the other thing which is becoming very clear post-COVID, that even practitioners who are in practice, how do you provide some training to them so then they can use them in their practice? So all
Very
in
true.
all, that will be Sunday.
Excellent. So,
That's
Dr.
the,
Garg,
that's the plan.
wonderful. That's really commendable. Friday to Sunday, it's going to be absolutely full with knowledge and wisdom of all these experts coming forward and sharing their views. But we'll go for a break now, and once we come back, I would just like to touch upon what kind of lessons have we learned from COVID, and especially with what we are talking about and how it has impacted and what all is happening. We'll talk all about this just after this short break.
Yeah, that will be it's very, very practical and very much related to the conference.
Absolutely. So we'll talk about it just after a short time.
ਘਰ ਇੱਕ ਐਸੀ ਥਾਂ ਹੁੰਦੀ ਹੈ ਜਿੱਥੇ ਹਰ ਕੋਈ ਆਪਣੀ ਨਿੱਜੀ ਜ਼ਿੰਦਗੀ ਦੇ ਸੁਨਹਿਰੀ ਪਲ ਯਾਦ ਰੱਖਦਾ ਹੈ। ਉਹ ਜਗ੍ਹਾ ਜਿੱਥੇ ਉਹ ਰਹਿੰਦਾ ਹੈ ਤੇ ਪਿਆਰ ਭਰਿਆ ਜੀਵਨ ਬਤੀਤ ਕਰਦਾ ਹੈ। ਇਹ ਗੱਲਾਂ ਤਾਂ ਹੀ ਪੂਰੀਆਂ ਹੁੰਦੀਆਂ ਨੇ ਜਦ ਕਿਸੇ ਜਗ੍ਹਾ ਨੂੰ ਸਜੇ ਹੋਏ ਘਰ 'ਚ ਬਦਲਿਆ ਜਾਵੇ। ਨਵੇਂ ਘਰਾਂ ਨੂੰ ਫਰੇਮਿੰਗ ਤੋਂ ਲੈ ਕੇ ਫਿਨਿਸ਼ਿੰਗ ਤੱਕ, ਡ੍ਰੇਪਰੀ, ਪੇਂਟਿੰਗਸ ਤੋਂ ਲੈ ਕੇ ਡੈਕੋਰੇਸ਼ਨ, ਅਸੈਸਰੀਜ਼ ਤੱਕ ਤੁਸੀਂ SK ਹੋਮ ਡਿਜ਼ਾਈਨਸ ਦੀਆਂ ਪ੍ਰੋਫੈਸ਼ਨਲ ਸਰਵਿਸਿਜ਼ ਲੈ ਕੇ ਆਪਣੇ ਸੁਪਨਿਆਂ ਦੇ ਘਰ ਨੂੰ ਹਕੀਕਤ 'ਚ ਬਦਲ ਸਕਦੇ ਹੋ। ਕੰਟੈਕਟ ਕਰੋ ਸੰਦੀਪ ਕੌਰ 6048259295।
ਜੇ ਕਿਸੇ ਬਿਜ਼ਨਸਮੈਨ ਨੂੰ ਕੋਈ ਪਿਆਰ ਕਰਦਾ ਹੈ ਤਾਂ ਕੀ ਵਜ੍ਹਾ ਹੋ ਸਕਦੀ ਹੈ? ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਦੇ ਓਨਰ ਸੁਖੀ ਬਾਟ ਨੂੰ ਵੇਖ ਕੇ ਇਹ ਗੱਲ ਸਮਝ ਆ ਜਾਂਦੀ ਹੈ। ਇੰਟੈਲੀਜੈਂਸ ਦਾ ਉਦਾਹਰਨ ਇਹ ਹੈ ਕਿ ਕਾਰ ਸੈਗਮੈਂਟ ਤੋਂ ਵੱਖ ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਲੈ ਕੇ ਆਏ ਨੇ ਸਰੀ ਦਾ ਪਹਿਲਾ ਟਰੱਕ ਸੈਂਟਰ, ਜਿੱਥੇ ਤੁਹਾਡੇ ਲੋੜ ਦੇ ਹਿਸਾਬ ਨਾਲ ਤੁਹਾਨੂੰ ਲੋੜੀਂਦੇ ਟਰੱਕਸ ਬਾਰੇ ਗਾਈਡੈਂਸ ਦਿੱਤੀ ਜਾਂਦੀ ਹੈ। ਸਪੇਸ ਮੋਡੀਫਿਕੇਸ਼ਨ ਤੇ ਫਿਊਲ ਐਫੀਸ਼ੀਐਂਸੀ ਸਭ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਿਆ ਜਾਂਦਾ ਹੈ। ਸੁਖੀ ਬਾਟ ਟਰੱਕ ਸੈਂਟਰ ਇਹਨਾਂ ਟਰੱਕਾਂ ਨਾਲ ਹੀ ਹੈ ਟੌਰ।
ਵੈਨਕਾਸਾ ਟਾਈਲ ਅਤੇ ਸਟੋਨ ਸ਼ੋਰੂਮ ਇੱਕ ਐਸੀ ਥਾਂ ਹੈ ਜਿੱਥੇ ਤੁਹਾਨੂੰ ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਤੇ ਹਰ ਕਿਸਮ ਦੀਆਂ ਟਾਈਲਸ, ਸਟੋਨ, ਮਾਰਬਲ, ਬੈਕਸਪਲੈਸ਼, ਮੋਜ਼ੇਕ ਆਦਿ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਮਿਲ ਸਕਦਾ ਹੈ। ਇਟਾਲੀਅਨ, ਸਪੈਨਿਸ਼, ਚਾਈਨੀਜ਼ ਪੋਰਸਲਨ ਜਾਂ ਸਿਰੈਮਿਕ ਟਾਈਲਸ ਜਾਂ ਮਾਰਬਲ ਸਪੈਸ਼ਲ ਆਰਡਰ ਤੇ ਜਾਂ ਕਲੀਅਰੈਂਸ ਤੇ ਲੈ ਸਕਦੇ ਹੋ। ਮਾਲਕ ਡਾਇਰੈਕਟ ਟਾਈਲਸ ਇੰਪੋਰਟ ਕਰਦੇ ਹਨ, ਜਿਸ ਕਰਕੇ ਵਧੀਆ ਕੁਆਲਿਟੀ ਦਾ ਸਮਾਨ ਤੁਸੀਂ ਆਪਣੇ ਘਰ ਦਾ ਸ਼ਿੰਗਾਰ ਬਣਾ ਸਕਦੇ ਹੋ। ਅੱਜ ਹੀ ਵਿਜ਼ਿਟ ਕਰੋ 1304 84 ਐਵਨਿਊ ਸਰੀ। ਪੰਜਾਬੀ ਹਿੰਦੀ ਵਿੱਚ ਗੱਲ ਕਰਨ ਲਈ ਕਾਲ ਕਰੋ 604 330 7363 604 330 7363। Once again, welcome back to the program. This program is being brought to you with the support of Day to Day Wholesale Cash and Carry. This is British Columbia's largest South Asian grocery store where you can buy groceries, party-wear, and kitchenware at wholesale prices. More than 5,000 products are displayed on the shelves, and for best prices, unique grocery buying experience, and best quality products, come over to 7843 128th Street, Surrey. Phone number is 604 503 8787. They have also opened up their second branch on Fraser Street in Vancouver. So we are focusing our talk today on CINI 2022, and our guest is Dr. Arun Garg, who is the brain behind whatever is happening in CINS. And of course, along with his volunteers and dedicated staff, he has been working day and night to make CINI conference a success. And the idea is that we introduce integrative thinking and integrative health into our daily practice. So what else is happening and how COVID has impacted? Let's learn a little bit from him now. So, Dr. Garg, what lessons have we learned from COVID?
Yeah, thank you very much. And before we go into that, I must say that I thank you very much for that kind introduction. But CINS really is a collaborative, and there are so many people who have helped. Yes, I'm providing the leadership in terms of conceptualizing it and carrying the ideas forward, but it will not be possible if it wasn't for the support of a large number of our sponsors and supporters and volunteers and the board of directors. And each one of them are very dedicated, uh, and I'm so happy and so proud that all our sponsors, I mean Fraser University, Fraser Health, BCIT, Kwantlen Polytechnic, University of British Columbia. These were our major sponsors from the beginning, and then some industrial houses. They have stayed with us, and MD Management has become now our major supporter. And all in all, this will not be possible without their support. So I really uh, my gratitude to them, and credit really goes to them because they are the enablers. and
Absolutely.
and we hope to continue. The nice thing is that they are with us for 12 years now. The other thing I must also share with our viewers is part of the integrative thinking is the role of art, which it plays in health. So music and the sight and smell and the visual paintings. So this has been one of my uh, deep interest, that how we could bring that in our journey for integrative health. And that was a recommendation we made in 2010 conference, then in 2014 conference, and we weren't able to bring out anything solid. But Harpreet, I want to share, and your viewers will be very interested, that now we are collaborating with our own Indian Summer Fest, a joint project of artist as a healer. And they applied and got a grant from Vancouver Foundation, and there is a project underway where we'll be showcasing that. So that's another success and another
Right.
idea which has come through this collaboration, and will continue to do that. Your specific question about COVID, from my point of view, really, before when COVID hit, the whole world was in shock and was taken surprised what to do, because this is a virus which was a novo virus, they call it. It wasn't even in existence before. And because of that, there was no vaccine, there was no drug. So only thing you could do was empower people to take better care of their own health. And that's exactly what integrative thinking is. So I would say biggest lesson of COVID is that whatever we do, we need to keep people at the center and
Right.
have them aware of their health. And the big thing was prevention, hand washing, wearing a mask, wearing protective gear, physical distance. All those things are really only possible when a person
Right.
genuinely understands the impact of it and does it. And you
Yes.
cannot do that unless you engage them, you empower them, you educate them, and then they are part of your process, your journey. And as I'm so taken by that, that I would say our own work greatly enhanced, because now
Mm-hmm.
people see what we were trying to do. And I
Right.
already shared with you the example of vaccination.
Oh, yeah.
So I would say, to me, still, that is the biggest lesson of COVID,
Mm-hmm.
that in our journey of healthy society, and we're very proud in Canada, we have a public health system which permits access to health, especially when you need in disease management, that we need to also provide this opportunity for self awareness and
Mm-hmm.
self realization and self care. And I
Right.
would say that is the biggest lesson, at least from the journey we are on through
Mm-hmm.
CINS, and it confirms um, our process of integrative thinking, where you empower the individual, and very specifically lifestyle, the role lifestyle plays, the diet,
Mm-hmm.
the stress. Stress is a huge
Oh,
phenomenon
yes.
in all diseases,
Mm.
and and there are ways to control that stress. And then if you relate that stress to the person as a whole, and not in a negative way, but in an awareness way. So the
Mm-hmm.
role of mind and the role of intellect plays in understanding stress, positive thoughts, and your overall journey. So, to me, that really fits in with our vision of lowering the burden through individual empowerment and
Mm-hmm.
engagement and education.
Right.
And in chronic diseases, this plays a huge role,
Yeah.
because then you take better care of yourself, you're more aware of it, your diet, you're more aware of sleep, and
Very
all
true.
those plays a role in
Mm-hmm.
inflammation, immunological competence. And again, that even with the vaccine available now, I would say that is still an ongoing thing, that if people were more engaged in their
Mm-hmm.
self care, I think the outcomes will be better.
Oh, yes, of course.
Before I stop on that, I do want to clarify and make sure I'm not
Mm-hmm.
talking about that each individual is responsible for their care. They're part of it. Society still plays a role, and it's not a blame game that if you do this, this is not exclusion game. We need to look after everybody.
Very true.
And ones who have limited resources, social determinants play a major role.
Mm-hmm.
And this is incorporated to this integrative thinking. You
Right.
have to put extra effort. You have to make it extra possible that
Mm-hmm.
they are also involved. The cultural diversity and any barriers which that has, they are also involved. And that was another lesson of COVID.
Mm-hmm.
COVID clearly showed that the people of color, people of multiple diseases, people with the language barriers suffered the most. And now there is a fair amount of emphasis that somehow we need to correct that gap. So I would say that's another lesson of
Right.
COVID, which fits right in with what we've been saying.
Absolutely. And the mental health crisis, which is increasing because of COVID, is really expanding in a big way, and a lot of effort needs to be looked into that. And there it is that integrative health comes forward, and once we start taking care of ourselves, things can be absolutely fine. Dr. Garg, before I let you go, one last question from you, because this program, the CINI 2022, as you mentioned in the beginning, is with the support of those groups which come forward and sponsor these programs. So, for sponsorship, if anybody wants to come forward, do they have to be related with the medical field, or anybody can come forward and sponsor CINI 2022?
Yeah, that's a very, very obviously we're looking for help from any direction, and we will have a conversation. But all our sponsors are also engaged in delivery, or
Mm-hmm.
they have other purpose. So,
Right.
but I think we are looking at different ways. And
Mm-hmm.
on the note of sponsors and support, I'll be remiss if I don't mention your support and Harpreet Singh show. You've been with us from day one,
Thank you.
and you are our major media partner, and you have make it alive during the meetings, and our joint session has come out of it. So I want to recognize and thank you for
Thank you,
your
sir.
effort, your collaboration, and your work. And I hope we could take it to the next level. Uh,
Absolutely.
and and we, because you have raised it, I would say we do need to engage our own community and leaders in our community and businesses in our community. What can they contribute towards better health? And if their engagement and their sponsorship will help us and help programs like this, then that will be very desirable. So, because I think communications are so important.
Right.
So, not only sponsorship of our program, but our media partners, if they could support them, then that's also very much working towards a common vision.
Right. And where can people get hold of you, through email or any phone number, if anybody wants to get more information about CINI
Yeah,
2022?
so I think we work through our website, and our website has all our previous programs, has all uh, programs which we have recorded, all the media links and contents of the program itself, and we'll have a registration. It will be by registration, even though it's open. So
Right.
the website will be the best, and I think website also has email contact if anybody is interested in some
Right.
very specific things about sponsorship,
Right.
or if they want to engage. We don't have membership in our organization. We work through projects. So I think if somebody has some interest and have a specific project, we'll be very interested to collaborate, because ours is a small organization, very focused, and we are project oriented.
Right.
So I think, but it's all on our website,
Right. The CINS,
www.
yeah, the
thecins.org.
CINS.org. Right. Absolutely. Great. Dr. Garg, thank you very much for giving this information. And we hope that, again, as usual, I know it's going to be a grand success like the previous conferences. And let's hope COVID says bye-bye to us and we are able to now, after some time, once things get better, meet each other and have these conferences in person also. Once again, thank you very much to you and to your entire team.
Thank you.
Thank you. So ACE and Dr. Arun Garg, CINI 2022 17th ਜੂਨ ਤੋਂ ਲੈ ਕੇ 19th ਜੂਨ ਤੱਕ ਹੋਣ ਜਾ ਰਹੀ ਹੈ ਜੀ। ਇਸ ਦੇ ਵਿੱਚ ਆਪ ਸਭ ਨੂੰ ਖੁੱਲ੍ਹਾ ਸੱਦਾ ਹੈ thecins.org ਤੇ ਜਾ ਕੇ ਤੁਸੀਂ ਰਜਿਸਟਰ ਕਰ ਸਕਦੇ ਹੋ। ਵਿਮਨਸ ਹੈਲਥ ਦੇ ਉੱਤੇ ਫੋਕਸ ਰਹੇਗਾ ਇਸ ਸਾਲ, ਅਤੇ ਇਹ ਬਹੁਤ ਹੀ ਇਨ ਡੈਪਥ ਕਾਨਫਰੰਸਿਸ ਹੁੰਦੀਆਂ ਨੇ, ਜਿਸ ਦਾ ਮਕਸਦ ਹੁੰਦਾ ਹੈ ਕਿ ਸਿਰਫ ਕਾਨਫਰੰਸ ਹੀ ਨਾ ਕੀਤੀ ਜਾਏ, ਲੇਕਿਨ ਉਸ ਤੋਂ ਬਾਅਦ ਡਿਲੀਬਰੇਸ਼ਨਸ ਨੂੰ ਫਰਦਰ ਕਿਵੇਂ ਇੰਪਲੀਮੈਂਟ ਕੀਤਾ ਜਾਏ। And that is what CINS is known for, that whatever they say, they try to get it implemented also. And we have seen in the past, and definitely in the future also, they have a wonderful vision of involving the common public also, along with integrative thinking and integrative health, so that we can all have better health. Once again, thank you very much to you all for sparing your valuable time and being a part of this program. If you also want to talk to me or be a part of this program, you can contact me through WhatsApp at 604-603-7555, or you can email me at harpreetsingshow@gmail.com. ਲੈਣਾ ਇੱਥੇ ਹੀ ਆ ਗਿਆ ਜੀ, ਫਿਰ ਮੁਲਾਕਾਤ ਕਰਾਂਗੇ। Have a safe evening, stay healthy and enjoy yourself.